Good morning. For today's show, continuing our series on healthcare in America, I wanted to talk about the fact that all of us now have a full-time job that not only do we not get paid for, but we never signed up for, and we didn't train for, and we're not experienced at, but it is our job. I think many of you will understand as I continue with this show that if you have had a medical bill in the last 10 to 15 years, you have had to be an advocate for yourself. And that now, even an emergency situation becomes your job. We pay premiums to health insurance companies. And then these health insurance companies, starting back in the early 90s, they tell us where we can go to get coverage. Where they tell us, well, we will pay your bills if you go to this hospital or to this doctor. It's called in-network. Now, back in the early 90s, the first time I had experience with this was when the company I worked for offered two different healthcare plans. One was an 80-20 plan with a deductible. And then the other one was called an HMO, Health Management Organization. Now, we all, at least some of us my age, some of you younger people may not remember, but HMOs were touted as, first of all, they were cheaper. At my company, the HMO was a cheaper payroll deduction than the 80-20 plan. But what I didn't like and what stopped me from going with the HMO was the fact that I would have to give up the doctor, my OBGYN to be exact, that I had been with since I've been going to an OBGYN. I didn't want to give up my doctor. See, what the HMOs did was they told you what doctor to go to. They told you what hospital to go to. And then the other part of the HMO thing I didn't like was basically doctors were getting paid extra for every patient they had that did not go to the doctor. Now, the co-pays were very cheap. I think you paid $10 for an office visit with an HMO if you went to their doctor, the doctor they told you to go to. But the problem with the HMOs, as was described in the movie Damaged Care, and if it's available on DVD, please try to find it. Laura Dern starred as the real-life whistleblower on HMO's Dr. Pena. Google Dr. Pena. I swear to God, she was a hero. She brought out everything that was wrong with HMOs, including the very sad story of a young child who died. And Kaiser Permanente was sued. This was a working family, and Kaiser Permanente was their HMO. And their child got very ill one night, and they called 911. And there was a hospital 10 minutes from their house. But that hospital was not covered under their HMO. They had to go to Kaiser Permanente, which was 35 minutes away. And these people got in their car with their sick, dying child and drove 35 minutes. And by the time they got to that hospital, that child was dead. And they sued Kaiser Permanente. Because if they had gone to the hospital 10 minutes away, their child would have lived. Dr. Pena relates in the movie and in the book she wrote, Damaged Care. She worked for an HMO. And the rule at the HMO was deny, deny, deny. You deny every claim. Why? Because only 1 in 10 of our clients will fight a denial. The others are too stupid or too lazy or too uneducated to even know they can fight it. So you always deny it and pray they don't fight it. That's the rule. That was the rule. And one day, Dr. Pena was told to deny a claim from a client who was paying premiums to the HMO. and he needed a heart transplant, and there was a heart available, and the surgery was going to cost the HMO $500,000. And she was told to deny it. And that very same week, she went into the office to the lobby, and this new statue, this fountain, was in the lobby, brand new. And she found out that that statue cost $500,000. And she went into her car and she started screaming. She quit the HMO and she did whistleblowing on the HMO. That a statue was worth more than a human life to this HMO. Today, we are really no better off. We all know what in-network means. We all know what happens if you dare to go out of network because the better doctor is out of network. Many of us, myself now included, we have health insurance that we don't choose. Our employers choose it for us. So we have to deal with in-network. But here's the problem. This came across my desk. I was watching nightly news a few weeks ago, and this story came out about a woman who had appendicitis. She needed her appendix out. She had health insurance. The hospital where she scheduled her surgery accepted her insurance. That was a definite. Yes, we accept your insurance. So she went in for her surgery. But there was a little problem, because the surgeon who did her surgery was not in her insurance network. And the insurance refused to pay him one dime for taking out her appendix. Now, think about this. Think about it. I say we need to get to the Supreme Court, get these insurance companies lined up and say, you know what? And the hospitals too. How can a hospital accept your insurance, but then hire doctors who practice at that hospital who do not? Think about this. You're sitting home one night, you're enjoying a glass of wine, reading a book, all of a sudden, oh my God, I'm in agony. I need to get to the ER. Honey, take me to the ER. And you get rushed to the ER, to the hospital that your insurance accepts. You know which hospital your insurance accepts. You're in network. You rush into the ER. But wait, everybody stop. Oh my God, I'm in agony. But wait, attendant, ER physician, are you covered under United Healthcare? Because that's our insurance. You can't treat me. I know I'm in agony, but Jason, please call the insurance company. Oh my God, they don't take calls after 4:30. It's 10 o'clock. They only take calls 8 to 5, Monday through Friday. It's 5 o'clock on a Saturday. But I need to know, you can't touch me if you don't accept my insurance, because I'm going to get charged for an out-of-network expense, and that means I get charged for all of it. Mrs. Luciano, you need surgery right now. No, wait. Honey, please, ask the doctor if he takes our insurance. If he doesn't, we're going to have to wait till they can find a doctor that takes our insurance, or else we're going to have to pay the entire surgeon's fee, and surgeons are very expensive. They have very expensive lifestyles. Please, he's going to want to keep his country club membership. He's not giving this to us for free. I'm telling you, this is what your job is, everybody. And I can prove it. I was told it by an insurance company. I was told by my own insurance company, United Healthcare, that when we go to the doctor, when we schedule an appointment, first of all, we have to make sure that doctor is in our network if we want the visit covered in any shape or form. We also have to ask this doctor, again, doing their job for them, kind of, sort of. We have to ask the doctor, well, how are you going to code this visit, doctor? Then the doctor gives you the code. And as long as it's between 8 and 5, Monday through Friday, you can then we're supposed to call the insurance company and say, well, this is the code they're coding the blood work. Is that covered through an Affordable Care Act annual exam? And then if they say no, then you have the choice to say, well, I don't want that blood test. I want an annual exam blood test. But this is your job now. It's your job. And they know it. And they know that many of you out there don't have time to do this job. And you don't have the education to do this job. Most of what I've learned from health insurance has been through viewers, personal experience, and Google. I'm not a college graduate on health insurance administration. I don't know what codes mean. I do know that if a doctor gives us a code, I can type it into the computer and find out if it's a preventive test or a diagnostic test. But at the end of the day, I still won't be guaranteed my insurance will cover it. And listen to this, though. When you have an emergency, and I'm going to get back to this woman with the appendicitis, because she got screwed. When you have an emergency and your life is in danger, I'm in the ER with appendicitis. I could go septic at any time. But I have to sit and wait for a surgeon that my insurance will accept in network to show up to do my surgery. And let's think about something else that I have always found so stupid about these health insurance companies. They won't pay for the quickest and best resolution to an illness. But they'll pay for Band-Aid procedures. They'll pay for whatever. If I get my appendix out right away, okay, I will probably go home within 24 hours. I will have a quick recovery and no problems. I go septic, I'm in the hospital for days. The hospital's in network, motherfucker. And my insurance company going to pay those hospital bills. I'm going to end up having to, because I waited for the surgeon, because I'm not paying the surgeon. This poor woman with the appendicitis that was on nightly news, she got a $4,700 bill from the surgeon. Insurance payment, $0. You went out of network. But did she? She went to the hospital that is in network. How was she supposed to know that they allow doctors outside of that network to practice in their hospital? I submit to you they shouldn't. When you walk into a covered in-network hospital, you need to have the assurance that every single doctor and surgeon that practices in that hospital is also in your network. What if the surgeon that's in network doesn't have practicing rights at the hospital that's in your network? That can happen. Who the hell operates on you? I mean, the appendix has to come out. To add insult to injury, you know how doctors take that oath that I always talk about, that oath that goes in one ear and out the other because I'm a doctor now, I'm going to get rich, I'm going to make so much money. Gonna have the big house and the vacation house and the country club membership. I'm gonna golf every weekend. I'm so excited. Gonna have an in-ground pool. They forget the first do no harm, which is the first thing a doctor is said when they are taking their oath to become a doctor. First do no harm. You know what this doctor who removed this woman's appendix did? He got a court order and he garnished her wages. A single mother with health insurance. He garnished her wages till he got his $4,700 because he has expenses. I'm going to tell you what, doctors don't have expenses like you and I have expenses, right? I mean, I get it. Oh, I get it. Doctors do have a lot of expenses you and I never think about. The landscaper, the lawn guy, the pool people that maintain the pool and make sure it doesn't turn green when we have our fancy parties. You know, we've got 15 rooms, 4 bathrooms, doesn't clean itself. I'm a doctor. I can't clean the house. I might hurt my hand, my operating hand. Gotta hire a maid. Yeah. They have a lot of expenses. Gotta send the kids to the best schools. And of course, our children don't vacation at the Jersey Shore, shop at Kmart. We send them to New York once a year to get their school wardrobe. We send them to Europe for the summer to traipse around and be exposed to culture. They go to Aspen over Christmas skiing. They go to our beach house in Stone Harbor in the summers. We have a lot of expenses, us doctors and surgeons. Yeah. Well, guess what? Your patients have a lot of expenses too. Like very high insurance premiums, high insurance deductibles, working full-time jobs, getting paid a hell of a lot less than you get paid, trying to put food on the table, maintaining a house, oh my God, without a maid, doing our own laundry, mowing our own lawns, if we even have a lawn. Oh, the public pool pass, because our kids go to public pools. Oh, and then, the one bathroom, that takes so much work to clean. And oh, by the way, now we also have to do your jobs for you. Just tell us before you touch us that you're going to screw us over with the billing, with the coding. Just let us know. I'm not in your network. Do you want me to take the appendix out, or do you want to sit here and suffer for another 4 hours till we can find a doctor that's not drinking martinis at his country club to come in and operate on you that's in your network? Tell us ahead of time. Let us at least make an informed decision. There have been people in this country, many, this was on nightly news too. Some surgeons and doctors will say, oh, don't worry about not paying your medical bill. You can make a payment plan. No one will take your house. Some doctors and surgeons are actually putting liens on their patients' houses when the patient can't pay an unexpected bill. They're taking your homes from you, the ownership of your home, just because you had the bad luck to get sick, go to a hospital, and get a surgeon that wasn't in network. I think we need something that's a lot different than the Affordable Care Act, something that's different than Obamacare. I think what we need is an across the board, kind of like with the gay marriage thing. Gay marriage is now legal. If you get married in Massachusetts and you move to New Hampshire, your marriage is legal everywhere, no matter where you got married. I believe that the Affordable Care Act went in the wrong direction. Instead of saying, take sick people, take people that are going to bankrupt you because they're so sick and never paid a dime in premiums. How about stop telling people what doctors they can use, what hospitals they can go to? I pay you for a service. I pay my health insurance premiums. I should be able to go anywhere I want, and most importantly, I should be able to go to the closest health facility and have the best, or at least the quickly available surgeon to make me well. See, that's what your oath meant when you took it. First, do no harm. What bigger harm could you possibly do to somebody to say, well, good news, I saved your life, I got your appendix out. Bad news, I'm garnishing your wages, or I'm taking your house because your insurance company won't pay me. And after all, I'm a doctor. I have expenses. Political Paula, out.